Two common forms of allergy include type 1 and type 4 hypersensitivity reaction. Type 1, which happens immediately after exposure, is usually happening in the early age of life when the immune system is not developed sufficiently to deal with exposure to different elements in environment. In contrast, type 4 happens more in adulthood and can be triggered by repeat exposure to certain allergens. Type 1 happens immediately or within minutes after exposure. In contrast, type 4 usually happens a few days after the initial exposure, and eventually after recurrent exposure is going to happen sooner. Type 1 allergic reaction is usually induced by taking the allergen orally or inhaling the allergen, and less likely by exposure to the skin. It's associated with type of rash called urticaria or hive. In contrast, type 4 hypersensitivity reaction mostly induced by skin exposure, and the pattern is mostly in the form of dermatitis, which means the skin looks red, itchy, and dry, like what we see in eczema. What is very important to say is that eczema is with higher chance of allergic reaction. However, it's not the main cause. The main issue in eczema is the damage and weakening of barrier functioning of the skin. So skin cannot protect the underneath part of the body, especially the immune system, which is very close by, from environmental factors. It means if you try products over the counter, which is containing of multiple ingredients, each ingredient can be easily penetrate into the skin in eczema and irritate the immune system, causing allergic reaction or directly cause irritation of the skin. This is the etiology of type 4 hypersensitivity reaction. After the first contact and stimulation of immune system, the memory cells are formed and they are ready for the consequent contact later in life. So next time they will be much more prepared to react to. And what we see on the surface of the skin is the exaggerated immune system reaction to. So emollients can protect the barrier functioning of the skin and reduce the chance of developing contact dermatitis in the form of irritant contact dermatitis and allergic contact dermatitis. Type 4 hypersensitivity reaction is usually more likely to happen later in life and is not very much significant during childhood. In contrast, the first type of allergic reaction, which is mainly in the form of food allergy, is more likely to happen early in life when the immune system is not very well developed. Gradually, after repeat exposure of immune system to all we eat or exposed to, the reaction is gonna be more settled. We have parents of children who are suffering from eczema and they are much concerned about food allergy. In some of them, what they do by mistake is to eliminating the suspicious food from their diet without any investigation. The logical approach in this scenario would be to introduce a small amount of a wide variety of foods in children's diet, and observe them for any reaction. If they see any reaction, they can stop it and discuss it with their practitioner for further investigation. The investigation of choice in food allergy would be blood test, we call RAST test. And in this case, they check the titer of a specific part of immune system called IgE to each certain elements. If it shows the titers are high, then it needs to be validated by another test, which is a skin prick test. So once the diagnosis of food allergy is made, next step would be to do desensitization, which is something we refer our patients to the pediatric allergy team to proceed. And now back to type 4 hypersensitivity reaction, which is most likely to happen in adults, maybe is more common in patients with underlying eczema. Type 4 hypersensitivity reaction can be investigated by patch test. Patch test is application of suspicious allergen in a very small amount, which has been already prepared and provided by the pharmaceuticals on intact part of the skin, on the coverage, and then monitor the skin in following 7 to 10 days for any reaction. At next stage, once the diagnosis is made, it's also very important to see if the test results relevant to the patient's symptoms or not. And once it's confirmed, the allergen should be avoided. So in summary, eczema is not because of allergy, either type 1 or type 4, and it needs to be treated as well as appropriate approach to suspicious allergen we identified. In type 1 hypersensitivity reaction, desensitization, which is gradual exposure to a small amount of the allergen under the care and monitoring of the allergy team, would be beneficial. However, in type 4 hypersensitivity reaction, complete avoidance of the allergen